Well, Caroline, we've spent a lot of time on the Benefits Alliance Voice, educating clients around mental health and strategies that they can look at around, changes in medication and the drug landscape and what's coming down the pipe and making sure that people are proactive with their plan design. But one area that has seemed to always been neglected in benefit plans, gosh, for the last 20 years, it feels like, is vision care. And to a lot of companies, they could say, oh, it's expensive. Why would I have it? And not everybody wears glasses. As we're about to learn, vision care is more than just about the lenses and the price you pay for lenses, isn't it?
Yeah, most definitely. I know Vision has sat on page 6 of the benefit booklet for years and has had the same wording and the same coverage. I think what we're going to hear today, based on the session we had at one of our conferences, I learned a lot. And I think what we'll find out will be very eye opening.
Da-da-da. And it's great. And we're going to have the CEO of one of the largest Canadian owned optometry clinics in the country, FYI doctors, and his VP to join us today. It's going to be super exciting. So let's bring him in.
Let's bring him in. Great. Well, thank you for joining us today, Dr. Allen and Susanna. Let's kick things off and just hear a bit about your background. So, Al, over to you.
Hi. Well, thanks for the invitation to the podcast. Always appreciate educating people on eye care. My background is I am an optometrist, graduated from the University of Waterloo in 1990 and practiced for, just about 20 years. And in 2008, with a few friends, we decided to form a company called FY Doctors. It's grown from a few of us to over 400 locations across the country. We are the largest in Canada. We are interesting in that we manufacture our own lenses and we're a frame company as well. So our industry was very, very competitive, and optometrists were at a disadvantage. And we created a scaled business, that put us not at a disadvantage, but at a very strategic advantage, which is good for consumers. It's good for our optometrists, and certainly good for the industry.
Wonderful. And Susanna, let's hear about you.
Thank you. So I've been in the industry for about 15 years and knew of FYI when they got started. And they've always been very proactive and ahead of the curve in understanding what patients need, but also the industry. So when I got the opportunity to join the team, I jumped on it. And now, like, kind of seeing where we can get ahead, and a lot of the questions that people don't know in the industry of what optometrists do, what eye health can do for them, and how it impacts their life is really a big part of why I want to be part of that movement going through.
That's amazing. Yeah, that's great. And you're absolutely right. And yeah, definitely. Thank you for joining us today. It's definitely a hot topic, and I can say this as an advisor that one of the most common questions we get from all employers, whether they have 5 employees or 5,000 employees, is what about vision care coverage? I hear that all the time from my staff. They want more glasses coverage, and why hasn't the maximum changed? And with an aging population, we can just really start off by maybe educating people more from your eyes and your lens as I sit here and clean my own glasses, really what do optometrists do? And what are some of the real strengths of regularly going to get your eyes checked?
It's interesting. I think our industry hasn't done a very good job of educating people on what optometrists do. And you make a point about insurance coverage. It's a basic eye exam and glasses, and contact lenses. So, and that's what our industry has propagated. But there's far more to what optometrists do than that. Optometrists are trained a minimum of 7 years. Similar number of time to a medical doctor, dentistry, all of that. But our industry hasn't really talked about, the other benefits of eye care, the health, the general health, detection of eye disease, treatment of eye disease. So sure, we're measuring, you for what eyeglasses you might need, contact lenses, what your prescription, but it's the eye health component. And not only the eye health, overall health. I have stats here from big insurance companies in the US that say 34% of people who are diabetic are diagnosed the first time in an optometrist's office. 62% of people with high cholesterol and 39% of people with high blood pressure. And that's from the biggest vision care provider insurance company in the United States. We don't have as great a Canadian data. We're working on that, but we know there's a lot of similarities there as well. Think about productivity. Employers want productive employees, and there's more and more evidence that, with screen time, productivity is negatively impacted in a big way. Even the smallest of vision problems, people that might not even know they have a problem, productivity can go down 20%. So there's just so much to educate people on about eye care, yet the marketplace has been not about the importance of an eye exam and impact, productivity, impact on general health. It's been honestly pretty people wearing glasses and discounts. And when we talk to insurance companies, it's kind of that same perception. So I've honestly been very surprised at the lack of knowledge, and I don't blame the insurance companies. I don't blame employers. I blame our own profession and our industry, for really not getting the word out. I wanted to say, like, the eyes are a kind of weird part of our body. It's the only place where you can visibly see blood vessels and nerve fiber without doing a biopsy or scans or anything else. You're literally seeing blood vessels through the eyes. So more and more evidence around, I mentioned the basics of diabetes, cholesterol, high blood pressure, but now there's research around early detection of Alzheimer's, Parkinson's, all those kinds of things that are impacted in an eye exam. I'd also say the technology has gone through the roof in what eye care looks like. So, not all eye exams are similar. Our regulatory bodies, we as optometrists have to take ongoing continuing education, and our regulatory bodies, create a minimum standard of care. Well, that's very different than an advanced standard of care where massive new technologies have come into play, new treatments. We have optometrists doing concussion therapy, vision therapy, truly treating dry eye syndrome, which is very common, in the population, and new technologies have come out to be able to deal with that. We now know that too much screen time for kids creates myopia. So words like a myopia epidemic are out there, and there's now treatment ways to slow that progression. And again, what people understand is, it's an exam and eyeglasses, right? That's the story. Yet there's so much more out there. I could quote a whole bunch of more data around disease detection, impact. But the reality is, our hope is that we can educate insurance companies that this is an investment. Versant Health in the US, an HMO focusing on eye care, says the ROI on a vision care plan is 15 to 1 when factoring time off work, productivity, all of those. So, and that's not how people think about it today. It's like, okay, well, maybe we'll add on vision care, maybe we won't. It's you're sure going to have a drug plan and you're sure going to have a dental plan, but maybe there'll be a vision care plan. And I think it's just because, back to what I've said over and over again, we haven't done a very good job of educating really anybody about what optometrists do. I'd also say we treat eye disease. We treat glaucoma. We treat, you get a piece of something in your eye, a metal foreign body. People's often first reaction is, I'm going to go to emergency. Well, they should probably go to an optometrist, because an optometrist is highly trained, will have the absolute best equipment to deal with that, where not all hospitals do, believe it or not. So that's a piece of optometry that people don't really understand. If you have a red eye, you have a painful eye, optometrists are highly trained to deal with those kinds of things. And again, when insurance companies think about it, it's eyeglasses and a basic eye exam. And that's probably why people aren't as excited about vision care plans. It's not exciting to the employer because, the employees aren't as excited. Well, $200 doesn't cut it. I only get $75 for an exam. So that's, the challenge that we're facing, in insurance. So that was a pretty long answer, and I apologize for that. But I'll stop there and let you carry.
That was a great answer. Are you kidding me? I got about 1,000 questions that we could go, and you're right. We talk about all the time in our organization. First of all, we're very linked. Benefits Alliance is what we feel is our motto has always been better advisors, you get better advice. And we're big on data. So I love that you brought up a couple of key stats there, especially in 1 in 3 people being diagnosed with diabetes as an example in the United States through a proper eye exam. So speak to us like a little bit of like what's kind of your philosophy and your why then as an organization as you've really grown your organization to 400 clinics coast to coast you mentioned. Speak to us about your eye exam process.
So, we started as a bunch of optometrists that got together and we've seen consolidation. And consolidation can be good for an industry, but often it's not. It depends on who's consolidating, what their vision and values are. And we started to see consolidation happening in healthcare in the United States. It had been happening for a while. We've seen it in Europe. And in our industry where it was occurring, really wasn't patient focused. And the money that was being made was not going back into the business for technology and to better patient care. So, I look back at us as optometrists. We were competing against big chains. And as I said earlier, it was all about the product, not about eye care and impact on life and quality. So we decided, as a bunch of optometrists, consolidation is going to happen. Why can't a bunch of optometrists do it? And by doing that, we can drive what an eye exam looks like in the Canadian market. So we wanted the best of technology. So our company is majority owned by optometrists. So it's very, very unique in that world. So always patient care was first, the most modern technology, advanced imaging. A patient first focus was our story. And we were scared as independents that we could not ensure that story because other competitors' collations told a different story. And again, I keep going back to, pretty people wearing glasses and, a basic eye exam and product. And we're trying to tell a story that's very, very different about that, a story about wellness, prevention. I can tell you there's stories every second day about an optometrist finding, evidence of a brain tumor. As a practitioner, I've found that so many times, detecting, you know, uh, even first signs of MS can show up in the eye. And this is
Wow.
just something that people in a in a condition called optic neuritis. It's often the very first sign of MS. So there's just so many things people don't understand. How many people have come in and said, "I see fine," and we discover a retinal detachment, and the next day or that same day they're having surgery. That's vision saving surgery. So that was really our motto. We wanted people to understand that. And we knew that getting together would be compromises. We had to learn to do things together, that it wasn't always convenient. It required change management, but that working together created economic scale and growth scale. It allowed us to invest in technologies, that as an independent, we couldn't. We, own our own lens manufacturing facilities so we can be competitive in price. We own a frame company that has 8,000 wholesale customers worldwide. So it was by getting together that we could have a powerful enough entity to be competitive in whatever, you know, uh, with whatever kind of challenge came in the marketplace for us. Um, it's interesting at first people join for different reasons, but now it's about simplicity. Running a clinic is harder than ever. We get zero training almost in university for how to run a business. And it used to be simple before. You might put an ad in the newspaper if you were really getting aggressive. Go join the Rotary Club, and that's how you built your practice. Now we've got online reputation management. How do you get to the top of the search in AI? It's just so complicated to run a practice. For us, we continue to have record numbers of optometrists join us because we can make their life simpler. So that's become, our big mantra is, and our processes and automation. Vern Harnish, famous business author, said, the job of a CEO is to push the easy button, help people push the easy button, whether it be the consumer or your own teams. And over the years, we've evolved that scale so that we, can use technology to make that experience better for people internally and obviously our customers and patients as well.
feel like there's going to be a lot of puns when I say this, but when I look through the eyes of a plan sponsor,
Yeah, right?
um,
Da-da-da.
knowing that there's this preventative and proactive opportunity, right? All of those health conditions that you've listed off. My guess is not many know that that is even possible. So, how maybe I'll put this over to Susanna. How do you, as an organization, help? What are some of those education campaigns? How do you get that word out to, I guess, advisors, plan sponsors? Yeah, tell us about that, because outside of
Well,
this
I
podcast today and the thousands of listeners we have, we've got to get this word out.
Well, and I think that's really important to kind of step back for a minute and say that all eye exams are not created equal across the board. So when Al mentions a lot of these things that are being detected and that they can see, a lot of times you need equipment to do that. So you can go into some optometry offices and they won't have that there. So it is important to also educate patients what questions to ask when they're coming into an optometrist office, what they're looking for, what they're going to need and get. So that's part of the education of it too. And also, that's the beauty of in FYI, though, we do have a standard of care across the board that when they know they're going into an FYI office, the standard of care they're going to get. And then if they move somewhere else to another city and then they go into another FYI office, they're still going to get that same care. But getting the word out, I would say, is definitely our challenge. Like what Al said is this isn't just an insurance thing. This has been an industry wide. Patients need to understand. So insurance has a big voice. So this is a great way for us to come into play, but it is starting with what do optometrists actually do? Get in for your eye exam, understanding what those benefits are and understanding how it impacts their life. Because like even stepping back, when you ask people like what is their number one fear, going blind is usually in the top three at least. And so it's understanding, calling that out for patients to say, okay, this is preventative. I can go in and get this checked. I can go in and have that. So actually understanding what people are thinking about and what they need. Whereas before we used to sort of talk about more was happening on our end of things. But now looking at, okay, patients are looking at their overall wellness, their confidence, productivity in the workforce. Those are the things that now we're kind of communicating a little bit better. So we are using insurance companies. FYI is doing a great job sort of marketing across the board as well, but it is something that we continue to use the different voices to touch point with.
Yeah,
What are some of the questions that someone should ask or, an optometrist as they're evaluating where to go? What are some of those basic questions to ask?
Suggest you ask what's involved in a basic examination, what technologies are being used. Is there wide field imaging? It's just asking, how comprehensive the examination is really. Some people call an eye exam a basic eye exam. Some call it a comprehensive eye exam, and it's just kind of all over the map. Typically the more diagnostic testing and high tech, it is a higher cost. There's no government programs, that subsidize optometrists or install equipment. So, typically, price can sometimes be a good test. Of what's the quality. So if you see a very inexpensive eye exam, well, that's when I would have some buyer beware and ask the questions: what's included? What special tests are being done as part of the regular exam? So it's one of those things where again. I'm not going to say the most expensive examination is the best examination. That's not true at all. But typically, there is a higher charge for having all of the what optometrists would all call the toys. But the toys are amazing pieces of technology that again give us information that we might not have without.
Well, as we said, like it's one of the benefits companies have not done a strong job of reevaluating over the last several years, to say the least. I can say when I got in the business, not 5 years ago, unfortunately now, but it's what an eye exam was. There was plans that had $50 or $75 for an eye exam. It's still fixed cost today, even though that's 20, 25 years later. And you mentioned earlier about two things, and the first question would be, you talked about the developments in technology that are in play that most people probably aren't aware of. And you talk about, Susanna, you're right. I would say you take all the five senses, I think some of the least, the one that people would not want to lose would be their sight. And so, talk to us about some of the new developments in technology that probably Canadians aren't aware of, or two that you see coming down the path in the next year or two that maybe you could, speak to that a little bit more.
Yeah, so the technology I'm always most excited about is wide field imaging. So a lot of problems in the retina happen way out in the periphery, and without wide field imaging or dilation of pupils, and there is data now that even with not dilating, I don't know if you've been to the optometrist and put the drops in your eyes and widens out your pupils, and you can't see very well for a while, and the sunlight drives you crazy. If you've had that done, you know exactly what I'm talking about. Wide field imaging in a lot of cases means you don't have to go through that. If there's a suspicion of a problem in the retina way in the periphery, these devices can pick that up, and pick up, again, a lot of asymptomatic, disease that's early in its stage. So I love wide field imaging. Ocular coherence tomography is another thing that actually measures the thickness, of the nerve fiber layer in the back of the eye. Again, you can see things with that measurement that you can't see with the eye, no matter what diagnostic tests we do. There's certain things that this device will pick up that, that we just could never pick up before in a regular exam, or define, hey, there's this person's vision isn't as good as it should be from everything I see. What does this device show? New treatment modalities, are exciting as well, like treatment of myopia progression. We have new devices that are being tested for the treatment of macular degeneration, which is a leading cause of, legal blindness in the country, and certainly a huge problem, with the elderly. So there continue to be just more and more techniques, more treatments coming out. Because we have so many optometrists, we have, coming on 800 optometrists in the company and so many clinics, we often are the first to test new technologies. So we have at any given time quite a large number of beta tests going on where we can test this new technology out. And some of it, it's not what it's supposed to be. So you have to be very diligent about that. But others are pretty exciting. So.
I have a question about one of the top, health conditions in Canada. There's a lot of attention being paid and a lot of treatments for diabetes. So you mentioned how an exam can be the first diagnosis or the early detection of diabetes as one example. Would a subsequent exam show, through the use of treatment and medication and different diet and different changes that a person has, will it show improvement of the condition if you go back for another exam or not? I'm just curious. I don't know the answer.
Yeah, so certain things, I mean, when you see that there's diabetic retinopathy, so I mentioned the blood vessels being able to be seen, in the eyes. So, what you see in the eye with diabetics at a very early stage is something called microaneurysms, so little tiny bulges, that might be in the blood vessel. You might see little spots of bleeding, where the blood vessels have leaked, a little bit of blood. Sometimes the leakage is so bad it starts to impact vision. So that's a later stage diabetes. So, typically, for the very early stuff, you're not making it go away, but you're preventing it to get to the place where it's impacting vision. So, yeah, I mean, if there's a very severe acute diabetic retinopathy because of a leakage of blood vessels, it can create swelling of the retina in the central part of vision. There are treatments to improve that. But at that stage, there's permanent damage. And really, the goal of treatment is slowing. I mean, in a perfect world, it's halting, but it's really slowing the progression, of the disease. It's interesting. A lot of, there's so much work around diabetics, and certain populations are much more prone to diabetes, like First Nations, and there's not the access to eye care, so it's a real problem. It's a problem we're trying to solve in our organization. We just took delivery of our first mobile clinic, this big Kenworth chassis that we plan to take, and I'd love to do 10 or 15
Nice.
more, to be quite honest. But when we look at diabetes, there's all kinds of studies. About productivity impact. I've got a graph, in front of me. when there is any sign of diabetic retinopathy, this chart talks about, sick days and time off. So again, I won't bore you with it, but yeah, it's big when you have that stage that there is evidence in the retina. It can be a real big deal in the workforce.
Oh,
So
sure. Yeah. Yeah. We talk about, the three pillars of your well being and your physical, your mental, and your financial well being all the time with an organization. And our advisors talk about that with their clients. And you're absolutely right. Like it's an absolute impact. And, maybe Susanna, it came up, if I'm correct, Canadians are much less insured than a lot of the other OECD countries around the world when it comes to vision care. And for companies listening right now, if you don't offer eye exams in your plan, for argument's sake, in terms of your total cost, your total benefits plan, it's going to raise your cost like 1%, bottom line, to add a proper eye exam program. Like it's not significant. So, maybe Susanna, talk to us about, what do you see in the other developed worlds compared to what we see in Canada? And some of the flaws in our Canadian, vision care plans as employers.
Yeah, and I'll start us off and then I'll let Al kind of jump in too because he is really in depth in this category. But I will say the first conference I came to at Benefits Alliance, I'll admit people almost laughed that I was there because they were like, well, we don't even talk about eye care. Like, what are you hoping to accomplish here? It's just part of the plan. Like, it's just there. There's nothing to talk about. And so that first conference, I kind of just took a lot in and didn't say all that much. And to your point, though, Rob, that you brought up is that when you talk about mental health and like well-being, like mental comes into play, your financial, your physical, and eye care actually touches on all of that. So it's when we take a step back and we go, okay, where does this actually play in as we started being able to deliver a better message and people understanding, okay, to your point, if you're not insured of what's happening down the road, how that impacts financially. But also when your productivity starts to lower, your confidence level in that, how you're feeling showing up, how you're, feeling actually going home after that. If you're not fit with the right glasses, you're giving confidence of just physical appearance. Like that is actually part of it as well. And this is not just for our age group, or young kids as well, as soon as they're getting fit in. They're going to school the first time they're getting fit with glasses, this all ties in. So if a financial constraint is part of that, that actually starts to take us down a different road of where it's tying in. So once we started hearing that, we started having that discussion as well of, okay, what actually needs to change? It's not just the messaging, but it's also, okay, we started 10 years ago. All this equipment Al mentioned 10 years ago was not the same list that he would have gave you. 20 years ago, probably majority of it wasn't on there. So now you're going in for an eye exam that you're going to ask those questions. What's covered? What are you detecting? What are you asking for? Well, there is a different cost to that. So that's where I'll actually turn it over to Al, though, to actually get into the differentiation of what the coverages are that have switched over.
yeah, so it is a challenge in Canada. Like my best numbers, Canadian Vision Council research is about 40 to 42% of Canadians who come in for eye exams report having some form of vision care coverage. You look at that number and it's the mid 70s in the United States and Europe, it's much higher. So again, it goes back to that lack of education. It also goes to the system as well. So, we have some government coverage of eye examinations and certain coverage for eyeglasses in certain populations, but it's all over the map. Every single province is different. Um, you know, um, some countries have a national kind of push for vision. In Canada, it's not. So what's happened is most vision care coverage is part of what insurance companies do. In the United States, most vision care insurance comes from standalone vision care insurance providers. It's not a rider or a small component of the overall insurance package. So by far the biggest entities in the US. So that's what they do. They focus on vision. They do a much better job than, I would say insurance companies do in Canada for sure. because that is their sole bread and butter. And so they are out there, they're educating employers. And it's been very effective in terms of getting that coverage. We know that when people have vision coverage, this is both Canada and the US, that they get their eyes checked more often. There's less space between eye exams. The data in the US is 17 months between eye exams. In Canada, it ranges from about 25 to 29, depending on the source. So that's a material difference in how often people get checked. And having insurance is a big factor. People say, yeah, I mean, the reasons people don't get their eyes checked is they don't think they have problems. 28% cost, 29%, and inconvenience 10%. The inconvenience is tough. That's something we have to do better as a an industry as well. But this whole concept, number one, 28% no eyesight issues or symptoms. The biggest things that cause blindness are problems in the retina. And the eye, again, is an interesting organ. The front of the eye, the cornea, is very, very sensitive, one of the most highly sensitive, if not the most highly sensitive area in the body. But the inner lining, the retina, where all those blood vessels and nerves are, and that's really the foundation for vision. If you think of a camera, the front part of the eye is like the lens, and the back part of the eye is like the film. And there are no pain receptors in the retina. So you can have major stuff going on and you're not going to have pain, like zero pain. And generally, problems in the retina start in the periphery. So, how good are we at noticing our side vision? Not super good until it gets really bad. So that's something we want to change. I mean, I'll jump into some more facts that kind of drive me crazy. I look at the dental industry, and they've done such a great job at creating awareness, and you have to have dental coverage, and people are going in for regular cleaning and maintenance, and they've managed to create that cadence with patients, and we just haven't. 1 in 4 Canadians who don't wear glasses have not had an eye exam in about 10 years. 16% of Canadians were over 31 when they had their very first eye exam. 75% of vision loss is preventable if caught early. And, we have just about a million, Canadians with glaucoma, probably one of the most undetected eye problems before it's too late is glaucoma. When you start having symptoms with glaucoma, you know, we can slow it a bit, but you're going to have major issues. So there's so much around prevention, in eye care, and dentistry's done a great job. Optometrists haven't. So we're going to work really hard. We have been, educating insurance companies. I almost feel embarrassed and ashamed when I go tell stories like this because, oh my God, why don't they know? And again, we rely on our regulatory bodies and our associations, and we're not a huge profession, and it's just been difficult for them to really get out there and educate. I think there's much more of a push now that people understand. There's been a lot of talk about how we can educate, and Suzanne had mentioned insurance companies have so many clients. They are now more into wellness and education, so they're interested in, hey, I want use our app, our website to not only just have a place for people to look up benefits. It's like, hey, I want to learn. Why would I have eye care? Why is it important? So there is definitely the push for not just awareness, but prevention and outcomes. I hear, insurance companies in Canada now talking about outcomes, which, as you know, is a huge thing in the US. I mean, it's a complex, complicated system, but outcomes are a big part of the whole remuneration, for practitioners in the United States. So I think we're getting there. It's just, it's been too slow, and we're trying our best as we grow. We have more resources to create education. I mean, Susanna has been doing a lot of education out there. I think we've stepped up our education in the Benefits Alliance group, and I think we're going to talk again, and continue to try and do a better job for them. One thing we are building right now is a package, to give to brokers, to help them talk about, vision care and the benefit and the upside. So I think these are things that we can do to, really help get that awareness out, and make it easier for brokers to do their job, and make it easier for employers to truly see the positive impact of, hey, don't just dismiss that eye care benefit. This is of real value, and here's why. And here's why, probably we need to look at changing how, we're covered. Sure, we can have an allowance product, and there's all kinds of ranges of prices of product, but there's also special diagnostic procedures, special treatments like dry eye, like myopia control that, the typical vision plan just has nothing for. Yeah, maybe there's a health spending account, but health spending accounts, people have to decide and compete with where those dollars are going to go if they're lucky enough to have them.
I'm glad to hear you have a package on the go for advisors, because my next question is going to be over to Rob. I was about to ask him, with all of the things that plan sponsors, have to address at your regular meetings, this is another one to add to the list. So how to disseminate that? I'm glad to hear there's a package. But Rob, what are you thinking in terms of your own clients, and where do you go from here as an advisor?
Well, I'm thinking for myself, first thing foremost, I'm going to be booking an eye exam with an FYI doctors when we get off this podcast. And then second of all, we're going to make sure we put a lot of Al's stats in our show notes, Caroline, so if everybody can hear that and follow, we can relate it back. So everybody can have those stats. When as an advisor, vision's always been one of those cost benefits. Well, not everybody wears glasses, but I have to pay quote unquote premiums for everybody. But when you talk about modernizing benefit programs that we talk so much about, Susanna, is around what was covered in 1985 or 1995. There hasn't been a lot of changes. And, insurance companies, are in the business to protect against, large scale risk and pay claims. And so the design is critical for employers more than ever before. And as you said, with more people in front of screens, not just employees, but their children, right?
Yep.
Everybody's kids are on a tablet or a phone, right? It's teenagers. And when you talk about return on investment, I think those are areas that if I'm talking to an employer, is what are your goals in around not only modernizing, but is what they want to see is that value back. And if you can get in a situation where you can help somebody have an early detection of a disease that they didn't even know about. Like I wasn't even aware I wouldn't feel any pain in my retina if there was really something catastrophic. And unfortunately, I've known a couple of people where they've been rushed to hospital, and one of my buddies lost his eye because of the pressure that had probably been building for so long that who knows if it could have been early diagnosed, could it have changed things? I don't know. So, I think about that proactive, Caroline. I think of that a lot. I think about, is that a proper eye exam, as Alan said, could return a 15-to-1 investment. And that's a greater investment that you're going to see in so many different other areas when more companies more than ever want to focus on employees' well-being.
Yeah, most definitely. Well, as we wrap up here, I think I'll ask, that's great to end on the advisor note. I think education and those stories will come out, and that's the impact. Like, as soon as you said that, when we started the call today, I said, oh, 3 out of 4 of us are wearing glasses. And Susanna, she must have a passion for some reason. Maybe she wears contacts. But I've learned so much more. There's more to it than what is on our face, right? So I think my last question for both Al and Susanna is, what is one thing you want to make sure that either your typical Canadian walks away, that they want to come away from hearing this, what's next? And then, same for plan sponsors, the key messages you would have for them to remember from this podcast.
Yeah, I mean, I think it's get your eyes checked. Don't assume that a painless eye is a healthy eye, and don't assume that your vision is good. Vision change occurs so slow. Sometimes you don't realize it. I can't tell you how many times, I've shown people what they would see with lenses and without, and they just can't believe it. They had no idea how many times people think it's normal to get a headache and have to take multiple breaks, after staring at a computer screen. It might not be glasses. It might be eye coordination problems that, we prescribe exercises to help solve that problem. So it's not always glasses. There's a lot of people that don't need glasses that do need other types of treatment. So it's just trying to break that mold between, eyeglasses and eye care. They're very, very different things. And, thanks for sharing, Rob, the stories of those people, that do have the problems. I just hear them every single day. That's one of the great things about my role now is I can hear from 800 optometrists, those stories where, you know, it's interesting. We put a wide field imaging device in an office that we acquired, and the optometrist was an older school optometrist. And I just heard this story 2 days ago, and he was going off to Europe in a couple of days, and one of our staff put him behind the wide field imaging machine and found out he had a retinal detachment he didn't know about. He
Oh,
went and had a surgery, and just laser surgery, lucky, not complex. Surgery, and was able to get on his flight to Europe after that. So it's just those stories. And here's an optometrist that, I don't really believe in this wide field imaging. And, it's kind of the best story I've heard in a long time.
that's amazing. I got one final question. So, if you had to properly design a benefits plan, this could be for Susanna or Al, what would you want employers to cover when it comes to an eye exam in their benefits program? So, I'm thinking as a benefits alliance, if we're pushing back on insurers to expand what's eligible in eye exam, what would be your perfect plan?
I'd say that the examination fee is low. An insurance company could have a basic eye exam and a comprehensive, and then define what's part of those exams. I think that would be a good step in terms of the differentiating between a basic exam and then just one that has a whole bunch of extra testing. I think we need to look at allowances differently. I think there should be a diagnostic allowance, almost like a health spending account approach. If there is special testing that's required, great. I think the product piece, yeah, I mean, I know on the product side, you can pay a bigger premium, have a bigger, coverage. I think, obviously we like to push for higher coverage. But I think what's really missing is these other treatments. I think in dentistry, the codes are so complicated, but you've got crowns, you've got implants, you've got all these different types of codes. And I think optometry needs something much simpler than that, but there should be, coverage for myopia control. Children that need special treatment, special product. Right now, they fall through the coverage. There should be vision therapy. Again, I talk about eye coordination, and sometimes it's as simple as exercises, but sometimes it's much more complex. Coverage for that, coverage for dry eye treatment. That's come so far. Like 35 to 40% of people have dry problems, and it's funny. Practicing, I was always ask people if their eyes water, and how many people say their eyes water when the wind blows, and obviously as you get older, and that's dry eye. Basically, we know when something touches our eyes, there's a tearing response, right? You get something in your eye, it tears. Well, when you have dry spots form on the eye, it's like something's touching, and then the flushing mechanism comes out. So the tears are made up of a water component, an oily component, and a mucus component. So not having the mucus component and the oily component at par is going to create an extra watery eye, and that's part of dry eye syndrome. So there are treatments for that, special ways to diagnose it, and the treatment can be very effective. It's beyond just putting drops in your eyes in many, many cases. So, um, yeah, you can tell I get excited about this, but all these things I get excited about, and the new technologies we don't have coverage for, and maybe in a health spending account, but that gets eaten up pretty quickly.
Yeah.
So
Well,
I'd
we
love to
love
see.
we love your passion. We appreciate you sharing that with us, Al, for sure. Yeah. Susanna, any final thoughts?
Oh, well, I want to say, like, we talked a lot about what changes need to happen. I do want to say there is changes that are occurring. Like, even just when you mentioned you're going to go in and book an eye exam after this, every meeting that we do have now, people are like, I'm either going to book in or I'm getting my kids in. And, when you mentioned about the passion in this too, like, I actually by fluke ended up in optometry and, working with them. But every time working with an optometrist, and even when you hear, to Al's point, they say they don't necessarily know. Your kids don't even necessarily know that they're not seeing properly. But when you see a kid put on glasses and they go outside and they're like, I can see the leaves on these trees. I didn't know a tree had these leaves. I just thought it was one whole thing. Those are the things that just touch your heart and you cannot get away from. So it just lights you up. But then going forward, like there is the cases of the vision therapy, that all of these things, when you're starting in on that and people are hearing the story and understand what eye care can do, it is starting to ripple. So It's not going to happen overnight, to Al's point. We're just sort of getting started. It's really only been the past couple years that FYI has even been in the position to really have a voice to get it out there. And then having the support of you and having those conversations, it'll start to get out there more. But I think that starting point is just having that conversation, understanding. And then once people start seeing what those effects are and the benefits, we will actually be able to start to have a real story of why coverage should change.
Awesome. And now we've got the BA voice to get it out there.
Yes. Well, I got
So-
excited at the conference when you talked about on the pharma side, everything you guys are doing. I'm like, vision care will be next.
Yeah, awesome. Well, thank you both for joining today. We'll end it there, but really appreciate you spending time and energy and education and passion to help get that word out. And we'll have you back again another time.
Absolutely.
Amazing.
Thank you
Thank
both.
you so much.
Sure. Appreciate it.
This has been the Benefits Alliance Voice. If you enjoyed this episode, please share it with your network and be sure to check out the podcast notes for any additional materials.